So I know a lot of you have been asking for some part-time work from home jobs. I found a couple of them for you. They're really not requiring much experience and the pay is not too shabby. So come with me as we scan through them. So the first job I want to share comes to us from the company Big Leap Health. They're a digital healthcare platform that simplifies access to mental health treatments, and they've been around since 2024. And right now they have a really good opportunity for all of you just getting started in medical coding. This one does not require much related experience. I'll get into that in just a minute. So Big Leap Health has an opening for a coding specialist. This job is part-time remote anywhere within the United States. I did not come across any location restrictions anywhere on the job description. Let's take a quick peek at the application because sometimes they do hide location restrictions on the application. And nope, I don't see any location restrictions on the application either. So this is a contract part-time opportunity working 10 to 15 hours per week, a flexible schedule anywhere in the United States. And what you're going to do is audit coded claims against clinical documentation and catch the patterns that create compliance risk, such as unsupported add-on codes, EM mismatches, and template errors. And early on in this job, you'll also do some direct coding as the internal coding tool is validated. You'll also support an annual MIPS QPP eligibility review across the provider portfolio. And to be honest, I have no idea what MIPS QPP eligibility is. Hopefully, if you're familiar with medical coding, you do know what that is. And they tell us over time, this role will also take on payer audits as they come in. And all they want from you is strong, recent, hands-on experience with medical or behavioral health coding and auditing. They're not saying you need several years of that experience. You just need some experience. So I take this to mean this job could be a very beginner-friendly, very entry-level opportunity, especially if you're comfortable auditing and correcting coding claims and you have strong communication skills and a willingness to sign a business associate agreement, and you can comply with HIPAA requirements for handling protected health information. They tell us it's a plus you're certified, and they prefer you have behavioral health psych coding background, especially EM and psychotherapy coding experience, and they also prefer you have prior audit and compliance-based experience. And those three things are just preferred, they're not required. And when it comes to the salary, as we go back up to the top of the job description, they tell us they'll pay you anywhere from $25 to $31 per hour. We have another part-time remote job. This one is with Zenera Health. They've been around since 2023, and what they do is provide clinical decision support tools and workflow optimization systems specifically built for psychiatry and behavioral health clinics. They're looking for a clinical concierge to work part-time remotely anywhere within the United States. And as we scroll down to the bottom of the job description, they tell us training is provided and you'll work 20 hours per week. So your schedule consists of 4 hours a day, Monday through Friday, from 1 p.m. to 5 p.m. Eastern time zone hours, which translates to 10 a.m. to 2 p.m. Pacific time. And you do not have to live in the Eastern or Pacific time zones. Just translate your local hours to these hours. And they tell us there may be some flexibility around the exact window, but the goal is to provide reliable coverage during the U.S. afternoon, and your hours may expand based on call volume. So this is not a sales nor a call center role. It's a high-trust concierge role for clinicians who are getting started with Zenera. So it looks like the company has a program called Assess, and what you're going to do is run short Microsoft Teams onboarding calls with physicians, follow up after early Assess reports, and help users get the most out of Assess and make sure questions or issues are routed cleanly. And you might also answer some inbound calls during the afternoon coverage window, though they expect inbound call volume to be low at the start. But it sounds like the majority of your work will be doing Microsoft Teams onboarding calls, so you need to be okay doing video calls. And they have more details. If interested in this job, just read through the details. So they're looking for someone who's warm, calm, and clear on video and phone calls. You're comfortable speaking with psychiatrists and mental health clinicians. You're professional and credible, and you're able to follow a script without sounding scripted. You're reliable, organized, and comfortable with video calls, phone calls, and basic software tools. And they prefer, but they don't require, they prefer you have a background in one of the following areas: nursing, psychology, social work, behavioral health, care coordination, psychiatric practice administration, medical office support, healthcare SaaS, or customer success, or you're currently studying in a relevant clinical or mental health related field. So for this live customer-facing role, you need a reliable high-speed internet, a a quiet, private place to take calls, a working webcam, clear audio, you're comfortable appearing on video, you have a professional, calm presence on camera, and you're able to troubleshoot basic call or video issues independently. And when it comes to the salary at the bottom of the job description, they tell us they'll pay you anywhere from $28 to $35 per hour. So there you go, 2 part-time work from home jobs. Hopefully one of them works out for you. So have a great day, take care, and I'll catch you on the next one.